A sharp increase in HIV and AIDS cases in south central Idaho has health officials urging vigilance. I'm your Twin Falls neighborhood reporter Lori in Nettleton, looking at what steps you can take to stay safe.
There are so many other preventable things, cavities, parking tickets, sunburns, that are not stigmatized the same way HIV is in our state.
As a physician addressing infectious diseases since the 1990s, Dr. Sky Blue says treatment and prevention of HIV and AIDS has come a long way.
We've made great progress. We've reduced, AIDS deaths by over half, new cases by nearly half.
Blue is the medical director of Full Circle Health's HIV clinic and says this isn't the first time the Magic Valley has seen an uptick in cases. South Central Public Health announced last week 15 cases of HIV, up from 9 in 2024, and 5 cases of AIDS, compared to 1 last year. Blue says in a high prevalence region like Seattle or LA, high risk behaviors such as unprotected sex or sharing needles would result almost immediately in infection.
In Idaho, because we're such a low prevalence state, you could be doing that for the last 10 years and not be positive.
But once a person is infected, he says many people in their circle also quickly become infected.
In that group that you're sharing needles with, or having anonymous sex, or in that dating pool, whatever you have it, all of a sudden you have one positive in that group, and now you have 5 new cases.
According to HIV.gov, about 1.2 million Americans have HIV, but 13% don't know it. Dr. Abby Davids is a Boise-based family doc and also provides clinical care for HIV and AIDS. To her, the stigma around the disease keeps people from having honest conversations with their medical providers.
In this day and age, we have excellent treatment. The thing that we still have a long way to go on is stigma, is screening everybody, getting people diagnosed early.
She believes broader, more frequent screenings would undoubtedly save lives.
We're not great at screening. And so when we do diagnose HIV, it tends to be when somebody already has symptoms. It's much better to catch it early and to treat it early before you ever get sick from it.
Walk-in testing will be available in Twin Falls on December 4th and in Jerome on December 9th. I'm your Twin Falls neighborhood reporter Lori in Nettleton, Idaho News 6.